Well, good afternoon, everyone. Hello, my name is Christina Maguire. I'm the President and CEO of MDI Hospital and Health Centers. And I want to thank all of you for taking time out of your day, this glorious day, to join us as we talk about and share information regarding vaccinations, particularly the COVID-19 vaccinations and the impact on our community. Before we get started today, I want to tell you we have some exciting news that we actually on Monday, June 14th, have completed our last final mass vaccination clinic, an effort that totaled over 10,500 doses that were distributed of COVID-19 vaccinations and administered over the last 6 months. We are deeply grateful to the entire team at the Bar Harbor Regency for their generous donation of the space for our large-scale COVID-19 vaccine clinics, to the community of volunteers who gave countless hours of their time to ensure that the clinics ran smoothly, and most importantly, to all of you that did your part to become vaccinated and help slow the spread and reduce the spread of COVID-19 in our vibrant island community. The state of Maine today is reporting vaccination rates on MDI are above 90%. That is a very important number, and we are truly, truly grateful for that incredible milestone. Going forward, vaccines will be available by appointment in 3 of our health center locations: the Cooper Gilmore Health Center, located on our Bar Harbor campus, the Trenton Health Center, located on the Bar Harbor Road in Trenton, and the Community Health Center, located in Southwest Harbor. As we navigate the final stretch of the pandemic, and we hope it is our final stretch, it's essential that we continue to our efforts for vaccine and having the availability for vaccination to help protect the health and safety of everyone in our region. And remember that we still have a group of children who do not have a vaccine that they are eligible for. So it's really important that we take care of our kiddos. Today, I'm pleased to introduce to you 2 of my colleagues who are at the forefront of our coronavirus prevention and preparedness efforts at MDI Hospital, Drs. Trevor Casey and Dr. J R Krevans. Trevor Casey is the Vice President of Innovation and Experience at MDI Hospital. Trevor has taken a lead role in our vaccine administration efforts in coordination with an interdisciplinary team of physicians, pharmacists, and nurses, geriatric clinicians, and infection control specialists to ensure that we have access to vaccines and, more importantly, education about the efficacy and efficiency of the distribution. Dr. J R Krevans is the chair of our Infection Control Committee at MDI Hospital and has been a guiding force for our COVID-19 preparedness, response, and educational efforts. He has an extensive background in public health, emergency preparedness, and the management of infectious disease. Today, we are here to answer your questions on the COVID-19 vaccines, provide vaccine and testing updates, and to share information about what we are learning as the vaccines are administered and treatments develop. Some of your questions were submitted in advance. If you would like to ask a question during the discussion, please feel free to use the Q&A feature located in the bottom panel of your Zoom screen. We will answer as many questions as we have possible during this hour and as time permits, as well as take additional questions. If we do not have time to answer all of the questions, we will follow up with a frequently asked questions document that will be posted conveniently on the mdihospital.org website. I'd like to thank our entire communications team for the work that they do on supporting our town halls, which is a provision for community health and wellness in our MDI region. And now please join me in welcoming our moderator, Molly Moon, who will facilitate today's discussion.
Thank you, Chrissy. We have a number of questions for you and our panelists to address today. So without further ado, can each of you in brief tell us if you support vaccination, why you hold these beliefs, and if you yourself have been vaccinated?
Well, Molly, I'll start. I absolutely support the vaccine efforts and efficacy. I am vaccinated. I do that to protect what I just mentioned. Right now, it was to protect our seniors as we were starting to roll out the vaccine on MDI and in this region. And now it's really to protect those kiddos and make sure that we can make a difference in the prevention of the COVID-19 virus. And that ongoing effort is really a way to continue to make sure that all of us remain healthy and safe as we look at these particularly variants that I know JR will talk about in a moment. JR, do you want to talk about the reason you believe in vaccine?
Well, I actually don't like the phrase believing in vaccines. I mean, that's like believing or not believing in getting in food. You know, if you don't believe in food, you still need to eat. You know, vaccination is the safer way to become immune to things. One of the ways I look at it very simply is pretty much most people over the next few years are going to become immune to COVID-19. A few may escape it depending upon where they live and their habits, but most people will become immune to it. The question is, do you want to become immune by getting a purified product that when you get it has a very low chance of causing serious harm and won't cause you to make other people sick around you? Or do you want to become immune by waiting until you take a breath at the wrong time in the grocery store next to somebody who is not wearing a mask and is infected? Because it's going to happen to you. So everyone's going to get immunized. The question is whether they're going to get immunized by a purified vaccine or whether they're going to get immunized by getting sick from the virus. With this particular vaccine, it's a bunch of things. Well, first of all, I'm 66 years old. I have a prior history of heart disease, which meant that I was at very high risk of developing problems if I got infected. And I work as a doc at the hospital. And I'm also out in the community as part of some other community groups, which put me in close contact with other people. I have a lot of family and friends that I want to protect, and I protect them by making sure that I don't become infected and infect them. At another level, there's this huge admiration I have for what happened. I'm kind of a history buff, and the closest analogy to the development of this vaccine last year were the Liberty ships of World War II. You know, we were on the wrong side of the ocean from where we needed to be, and we had to get thousands of people, millions of people, and millions of tons of supplies across the Atlantic and the Pacific. And in a few months, we went from not having merchant ships to building dozens. Interestingly, I looked it up, and there's almost exactly the same period of time from when they decided to build the first Liberty ship until it was launched, which was 240 days. It was 210 days from when Operation Warp Speed was declared until the first doses went into people's arms of the authorized vaccine. It's just a monumental scientific, engineering, and human undertaking that turned around an enormous, in one case, a war, and in the other case, an epidemic that threatened our society. So, part of the reason is just my sheer scientific and, I don't know, political is maybe not the right word. That's the wrong word. As a citizen, I'm just in such admiration of that effort. And it's a sort of a joy to be part of it.
All right.
Trevor, would you also like to respond to our opening question?
Yeah, absolutely. I definitely was vaccinated. Actually, Dr. Krevans and I were two of the first people vaccinated in this area back on December 23rd. We had two different sessions set up to give the vaccinations out to healthcare workers. And I was running one clinic, and so I was there first thing in the morning about 5:30 and got my shot, and continued to give shots out to employees and hospital workers and healthcare workers throughout the rest of the day. And when I got my shot, there was no question that I was going to get it, because I had the opportunity to meet with the scientists of Moderna at that point in time and Pfizer. I saw the work that had gone into it and the quality that really is out there to support the usage of this vaccine, and the science that we have now to really be able to develop this in a much quicker fashion we have years and years of experience to build off of that allowed this to be effective and allowed this time frame to actually be able to take place. And so I got the vaccine. I got the vaccine so that I could remain working. As the director of pharmacy, it was essential that I was available. In a small hospital, there's not many resources. And if all the pharmacists went down, we didn't have a way to keep our hospital open and functioning. It was so essential. One of our biggest concerns is how do we ensure that we could function and operate our organization without that protection that was essential to make sure we could take care of our community. That was one reason. The second reason is for my family. I have a just 11-month-old baby at home that I wanted to protect. I have 5 other children and 2 stepchildren that I love, and I wanted to protect them as well. Not all of them were eligible for the vaccine, and I wanted to ensure that they were all safe and protected, and that we could spend with a large family, that we could make sure that we were protecting each other as soon as possible.
Thank you, everyone. The following question is also for each of you to address. What is the concern surrounding women in childbearing years? And whoever would like to start may begin.
I'll start with that. I mean, there's a lot of, huge concerns. Like a lot of other viruses, COVID-19 is particularly dangerous for pregnant women. They're one of the identified very high-risk groups for bad outcomes. Bad outcomes means things like death and ICU hospitalization. And also at high risk for early delivery and miscarriage as well, if they get infected during pregnancy. So that's a particular concern for women of childbearing years. And for women who have kids, of course, if your children are under the age of 12, if you get sick, you can bring it home. And while it's less severe in younger kids, we certainly do see some very severe illness sometime in children. So for women of childbearing years, they are particularly need to get pregnant. The American Congress of Obstetrics and Gynecology, ACOG, which is sort of the doctors and nurse midwives who form the National Standards Organization, have particularly recommended that women who are either thinking of getting pregnant should get the vaccine as soon as possible, and that women who are pregnant should get the vaccine. There is no contraindication in pregnancy. In fact, many people consider it an indication. It was not. Pregnant women were not in the initial trials, but they have been subsequently vaccinated in very large numbers, and there's been no signs whatsoever. Actually, I shouldn't say that. Pregnant women were not recruited in the initial trials, but people being people, there were many members, and since the initial trials were mainly composed of, they were younger on the average. There were a lot of people in their 20s and 30s in the initial trials. So they ended up with quite a few pregnant people in the initial trials, though that wasn't officially planned that way. And then subsequently, there have been many, many pregnant women vaccinated. There's no sign whatsoever of any effect on pregnancy. And it has been very carefully looked at, and there is no effect of the vaccine on fertility. That was a myth that was out there that has absolutely no basis. I don't know where that came from, except that people maybe decided to make it up. And being effectively vaccinated against COVID-19 will protect you in future pregnancies. There's also some data that women who are vaccinated will give some degree of protection to their newborn that will last for a short period of time, several months.
And for me, I'll go, when we were first vaccinating, we had the age limitations and healthcare worker limitations on who we could vaccinate. And we continued to have patients call us to try to get special approval to get vaccinations because they wanted to get pregnant. But unfortunately, they were working with specialists in Massachusetts and Boston who would not do extra treatment to help them get pregnant without them being vaccinated. They felt like the danger of developing COVID was so much higher than the vaccination at any level that they wouldn't even work with those patients until they became vaccinated and fully vaccinated at that. And so it was such an interesting process as we worked through it. We learned more, and we read up on ACOG and those other things had other resources had said that truly pregnancy really was an indication to get the vaccine, and even the desire to get pregnant was definitely an indication to get the vaccine, and just another reason to protect yourself of the dangers of getting COVID.
I think I will echo the clinicians. I just feel that it's just really an important step for women in childbearing years, especially often they have young children in their homes. It's really important to think comprehensively about how to help not only their newborn, but take care of themselves as well as their family at home.
Thank you, everyone. And now for those of you watching or listening, we have a special guest with us today, Danielle Silverman, who will introduce herself as well as respond to one of our top questions. Danielle, as a mother, would you share with us your experience of pregnancy during the pandemic and also being vaccinated?
Absolutely. Thank you, Molly. Hi, everyone. I'm Danielle Silverman. I'm actually the Donor Relations Officer here at Mount Desert Island Hospital. And last year, I found out that I was pregnant right as the pandemic was starting to kick off. And I went through the normal emotions. I was excited. I was, surprised. And I was also terrified because it was a pandemic that we didn't know a ton about. And I didn't really know what that was going to mean for me and for my family, especially for my unborn baby. So we kind of kept our bubble pretty small for the last year. I worked primarily from home, and there were many spurts where my daughter, I have a 3-year-old daughter as well, and she stayed home with me as well, just to kind of make sure that we were as safe as possible. It was a challenging year for sure, but I actually had the opportunity. The vaccine was made available to me a lot sooner than I would have expected it to. And I would be completely lying if I wasn't terrified when I got that email saying when I could get it. I immediately was wondering if it was the right choice. And I kind of, for about a 24-hour period, I wondered that and what to do. And then I quickly realized that I had a wonderful team of experts that could help answer any questions that I had pretty much at my disposal, not only just because I am a hospital employee, but because they really are there for our community. So I did my homework and I talked to many people. I talked to my doctor. I talked to actually 2 of the people that are on this call right now, Dr. Krevans and Dr. Casey, and they all really answered my questions in a way that I could easily understand it because I don't have a science background, and they really empowered me in my decision. And ultimately for me, I made the decision to get the vaccination while I was still pregnant. I did receive my first dose. And even afterwards, I wondered if that was the right choice to make and if it was going to have some effect on my daughter. And once she was born, and every day since then, I've watched her grow and she's thriving and she's healthier. And knowing that she is partially protected against this virus has made me know that in my heart it's the right choice. And I'm really looking forward to the day that I can have my 3-year-old vaccinated, and then our whole family will be safe and protected for whatever's coming. So, thank you.
Thank you, Danielle, for sharing your personal testimony. And that was really a tall request for us to ask of you. And I know we all appreciate your bravery and your transparency in sharing both your thoughtful decision-making and your personal story. So truly, thank you. Our next panelist question is for Trevor Casey. Trevor, in a few sentences, can you speak to the science behind the vaccine and how the vaccine protects us against the virus?
Well, I think the science, and I keep nerding out on this if you've heard me before, but the science is not new science. It's been around for some time. When we met with the Moderna scientists, they actually talked about how they've had the vaccine ready to go. I believe it was for 13 years, and they had it sitting on the shelf. And so what they would do is, and they said every time that COVID would show up, they'd get excited and they'd go out to do a test, and then it would mutate and go away. And so they never got enough opportunity to test the vaccine to have it prepared until this came along. So a lot of people felt like, we went into this and it was all new science, it was all new, but this was old science just waiting around to be utilized. And so when they got the opportunity, they were able to implement those tests right off the bat and really get a jump start for approval. And so everything was developed and they had it ready to go. And so that's part of the reason why this was so successful. And that messenger RNA, which some people have said, can incorporate with your DNA or talk to your DNA, it can't. We have messenger RNA throughout our bodies. It's one of the most natural products that exists in the world. We destroy it so quickly is part of the reason why we have to get 2 vaccinations and the second dose of the messenger RNA vaccine to make sure that we develop appropriate response. But really what we're getting is a small little piece of the spike messenger RNA that talks to our body. It's in one little fat molecule, not enough fat to change your diet or anything like that, but just enough to initiate that immune response. And it's so purified, it's almost impossible to be allergic to it. We look back to the vaccines that we've taken over the years, and a lot of those vaccines have history of being not very purified, but slowly over time, they become so purified and so clean that the risk of an adverse or an allergic type of reaction is very, very rare. And that's the case with these. And they do emit a great immune response, which we get, and they do provide good protection. And we're continuing to learn about how good of protection as time goes on. And we continue to move forward to see how it's going to protect us in the future.
Thanks, Trevor. And at this point, I'd like to note that I am going to drop links into the chat where you can go to find more information on the virus and how to best protect yourself and your loved ones. These links are for the CDC, maine.gov, and for MDI Hospital. The next panelist question is for J R Krevans. JR, who cannot be vaccinated and why?
Well, the biggest group by far is people under 12 right now, because the vaccine is not currently authorized for anyone under 12. We are hoping before the start of school that will change, in which case we will have another mad rush mass vaccine clinic to drive Bob Miller crazy, but he'll handle it. He's very good at these things. And because several of the vaccines have got extensive data now in 5-year-olds and up, and they're in the process of getting approval. So that's by far the overwhelming group. There are a very, very few people who have a medical contraindication. There's an extraordinarily rare condition of allergy to glycols, which are a common product in a lot of over-the-counter products. They're in a lot of foods. And there are a very tiny number of people. Somebody actually recently did a study and identified 59 known cases in the literature that was done a few years, like 2017. They could identify 59 cases that were documented in the literature total. If people have anaphylaxis, not a sore arm or a rash, but anaphylaxis, a major allergic reaction to their first dose, they should not receive a second dose of a messenger RNA vaccine. That's very rare, on the order of about 2 per million, 2 people out of 1 million people who get the vaccine. So, in the entire state of Maine, if every adult in Maine got vaccinated, we would probably have 2 people with that contraindication to getting a second dose. Another group who should get vaccinated, but you'll sometimes hear people say they should not, and this actually will reach into a question that I've already seen come in on the chat. People who've had COVID should be vaccinated, because the immunity that comes from being infected with COVID has 2 differences from vaccine-induced immunity. One of which is it is not as robust, and the evidence is it's not as long-lasting. People who've had COVID, they're probably going to be immune for a year or 2 to the strain that they had, getting real specific there. But we know they have a great response to the vaccine. The vaccine acts as a booster to their weak immunity, which they typically will have after COVID. And so they should get vaccinated. The second reason is, and the question that came in on the chat is, how concerned are we about the variants? And literally, I guess the easiest way to answer that is, what does the CDC call them? They say they label variants into two groups. One is variants not of concern, and literally there's a group that they call variants of concern. We should be concerned about the variants of concern. The subequatorial variants out of Brazil and South Africa, the variant out of India, which now are getting Greek letters to, as we sort of try and label them. But basically all of these are subtly different. And the reason they have evolved is because one, you get these places with huge numbers of infections, natural infections, viruses that can escape that immunity will by definition evolve. So people who have been infected have a specific indication for vaccination, and that is to not only get a better immunity, but in particular to be better protected against the variants. What we know about the vaccines is so far, all of the variants are well controlled by vaccination. Perhaps not quite as perfectly as the original, but at this point we are seeing generally very good control of the variants with vaccination.
Thanks, JR, for providing us all with that education. And again, more information can be found from the CDC, maine.gov, and at our own homepage, mdihospital.org. And those links again are in the chat. Trevor, our next panelist question is for you. Are heart problems more common in teenagers who got the vaccine?
So you may have seen that they're doing research, and there's been cases of some heart problems that have been stated on the news that they're associated with the vaccine. There's research being done to see if there is any link, but this is this heart problem is a common heart problem that's found in teenagers. It's really common. To link it to the vaccine, so far they haven't had anything that would actually link it to the vaccine, but they're continuing to look because they want everything to be as safe as possible. But it's a common issue for that age group of teenagers, and at this point in time, there's no link to the vaccine to state that there would be anything to link it back to the vaccine that would be a cause and effect type of relationship for that.
Thank you, Trevor. I'm sure you just helped to settle the minds of many concerned parents and family members. My next panelist question is for any and all of you to discuss. What are the regulations for kids, masking, and transmission? And whoever would like to begin can begin.
So we'll talk about the age groups again, right? So if we delineate kids below the age of 12 and those above the age of 12 who are eligible to receive the vaccine, then they have some opportunity for being in spaces where they can not have to mask. Now, as of the 24th of May, the governor has released the mandatory masking mandate, but there still is some real value and clinical value for mitigation for kids to remain masked and for adults to mask around children as well, depending on their situation, outdoors, indoors, and as I think Danielle described, their bubbles, right? Who's in their bubble and what do they know about their bubble? So kids playing outside, who aren't vaccinated, who have been around each other and can maintain the air exchange that's necessary for mitigation of the aerosolization spread, probably are going to be okay. But if they're around adults that haven't been vaccinated, then there's probably a good reason to maintain masking. I know JR knows all of the regulations around this, as does Trevor, and they can do a deeper dive onto what is the important aspects of masking for children.
So, I mean, I guess I don't look at it as children or not children and regulate. I mean, part of the issue is that the quote regulations as they exist are unenforceable, because basically the rule is, if with rare exception, if you work in healthcare, the rules are different. We mask under a lot of other circumstances, partly because there's other infections we care about too. But if you're not vaccinated, you are a source. And the mask you wear acts as source control. That's literally what it's called now in the CDC literature. And if you choose or not to be vaccinated, you need to wear a mask when you are inside around people who might be at risk, because you are likely to, you have a high chance of spreading the virus. And that is the CDC regulation. And actually the state says people should follow the CDC guidance indoors, which means if you're not vaccinated, you should be masked. We're just not enforcing it as law, but that's what good practice is. And kids are no different than adults. Teenagers, actually, there's lots of data. Teenagers are just as effective at spreading it as adults. Small children do not spread the virus as effectively, probably because they just literally, they don't take as deep breaths. So it's less of a concern. The flip side of that is if you are an adult who has chosen not to be vaccinated, you should be masked when you're indoors with kids who are not in your bubble if they are under 12, because they have not had a chance to be vaccinated and it is not appropriate for you to infect them. And if you have not been vaccinated yet, wear a mask and get vaccinated.
Ditto. I just think masking, and I think it's important to anybody who is uncomfortable should feel free to continue to wear a mask. And I think that's, we're going to see more masking. Before this, we saw very, very few masks throughout the United States. But if you're uncomfortable, if you're questioning the situation, feel free to put on a mask. I think that's the way I look at it.
I guess I would also bring up one other thing. There are people, individuals who, people who've had organ transplants, people who have arthritis and are taking immunosuppressive medicines, people who have diseases like cancer that cause their immune system to not be effective. Even if they're vaccinated, they have only partial response to the vaccine. And places that are where those people are, which certainly includes healthcare facilities, but it may include some stores and other places. A lot of those places will choose to ask everyone to wear a mask because it's impossible for the store to know who is vaccinated and who is not. And any place that chooses to provide a safe environment for everyone, or essentially a comfortable environment for everyone, where by asking people to wear masks, that is absolutely their right and good practice. And of course, right now on all federally regulated transportation, in order to make sure that those services are comfortably available to all people, masking is still required. And I don't see that changing in the near future.
Thank you everyone for weighing in on that question. Our next panelist question is for Trevor. Trevor, has MDI reached COVID-19 vaccine saturation? And can you explain in simpler terms what that means?
Well, I don't know if we reached saturation, but we've vaccinated a lot of people. Saturation really is the point where there's not anybody else to vaccinate. But we do know there's pockets of people that haven't been vaccinated on this island and in our community, in our county. And that's why we continue to offer the vaccine. And, we respect everyone's rights, but this is a very important vaccine, and it is safe, and it is going to protect you, and it's going to protect your loved ones. And so that's really how I look at it. Yes, our data shows that the statistics show that we are around 95%. The zip code data shows we're around 95% vaccinated. That's using the 2010 census data. So it's a little bit outdated, but so if you give 5 or 10% on either side, we still have, we've done an amazing job on getting acceptance of the vaccine in our area, but there's still more opportunity, and we want to still make sure that it's available to everybody in our community and anybody who wants it. If somebody's coming on vacation and they want to come get a Janssen vaccine or J&J vaccine, we'd love to give it to them and really support that protection for them as well.
Thanks, Trevor, for simplifying that information for us. Chrissy, our next panelist question is for you. In regards to this summer on MDI, how can we best monitor our health?
Well, we're going to say what worked last year will work again this year. And if we participated and continue to participate in community efforts for education, mitigation, and efforts for proposing and continuing the use of masking. So one of the things that we think will happen to be safe on this island is what Trevor and JR just mentioned, is we should all be really empowered and feel that there is nothing wrong with having a mask wrapped around your wrist. I see a lot of them wrapped around people's wrists. So you can feel comfortable for the summer being on MDI and knowing that before you got here, almost 90% of our population is vaccinated. And so we did an enormous effort of protecting everyone who's actually coming to visit, but we don't know their status. So we want to make sure that we continue to support our community, support our municipalities, our businesses with continuing to provide masks to them. And to continue our efforts for education. This community forum is part of that effort. It's part of making sure that we get information out, that we're transparent, and we also are a conduit for our community who has questions, and that they know that both of these doctors on this panel today are ready and available to help answer questions. It can be really scary about this, as I call it, new technology, and Trevor tells me it's really old school technology, but it's important that for this summer to be vibrant and healthy, that we all really make sure that we mask, we distance when we need to, we get vaccinated. We're here all summer long. If you want a Johnson & Johnson or Janssen vaccine, it's a one and done vaccine. We are here to do that. The other support that we're doing, and we have great partners with our business partners, is we have quite a bit of influx of summer workforce. And the summer workforce has been coming to us and getting vaccinated to protect themselves as well. So we continue to look at these levels and layers of protection. Masking is always really safe. Think about, we didn't have a vaccine last year. And during the summer on MDI, we went from March 13th till October 10th with 13 positives in this community and had all of these visitors. So masking was key to that. Respiratory hygiene, which is washing your hands, and of course, distancing. If you don't know who's in your bubble, you don't know vaccine status, just remember those three things are really important.
Thank you, Chrissy. And now we have a question that came in from the live Q&A. The question is the statement that MDI is 90% vaccinated a statement about 90% of the population or 90% of the eligible population? In other words, is it pretty much everyone over the age of 12 vaccinated and the 10% unvaccinated are under 12? So I'm going to go ahead and rephrase that for you. If you guys could please respond to this question. Can you please explain how the percentage of our local vaccinated population is calculated and what that number represents?
So JR and Trevor begged me for months to try and get zip code data from the state. And we were not the only organization, but we worked with the state of Maine to provide zip code data on who had been vaccinated. And part of that effort was we needed to work on our vaccine efforts, our community vaccine efforts in education, to know where our pockets were. If we were 99% vaccinated in our zip code of 04609, the Bar Harbor region, then okay, where should we go next? What and how the state was able to do that, and we're very thankful that Commissioner Lambrou and Dr. Shaw put some effort and energy to do this, is they only had census data from 2020, and that's what Trevor was, 2010, sorry, that Trevor was referring to. So there will be pockets of, and so that's everybody who lived or registered in the US Census on these zip codes in 2010. So we anticipate there will be pockets that go over 100% vaccination rates on this island. And what we should be celebrating is we have the highest level of vaccination rates in the state of Maine. So that by our region on the Mount Desert Island. So it does include not only eligible, but anyone under the age of 12. So anybody who would have been designated in that 2010 census is their denominator. Is it perfect? No, it's not perfect, but it did give us a way to measure. How are we doing against a specific census statistic that would help us find pockets where we needed to focus our energy, efforts, and education on?
Thank you for responding to that question. Our next question is also addressing the upcoming summer on MDI. For JR and Chrissy, what is the risk associated with travel? And if you could speak to kids and visitors on that, that would be wonderful.
Yeah, so travel is in both directions. I mean, we've actually had some recent micro outbreaks on this island related to people from the island who traveled elsewhere and brought virus back with them. So travel means, when we go elsewhere, there's a lot of places in the country. I guess I should start by, people need to understand some facts about the current epidemiology. Starting about 11 or 12 days ago, the number of cases in the United States stopped declining. I mean, let's just be real clear on that. COVID has stopped declining in this country. There are not fewer cases. For several months, we had fewer cases each day. That's no longer true. There are some places in the country, like Maine, where the number of cases are declining. California, the number of cases are declining. There are some places where the number of cases are rising. And in fact, it is so bad in some places that it's not just in completely healthy people. There are 10 or 11, it was 10 yesterday, but I've heard there was an 11th state added to the list today, where the number of people admitted to the hospital each day is greater now than 2 weeks ago. And that's basically because those states are choosing, and the people there are choosing not to vaccinate. So there are many places in this country where the virus is circulating widely at levels far higher than this area, and where most people are not vaccinated. And when they come here, if you go there, you will get the virus. When they come here, they will bring the virus. We just need to be really clear. That's no different than last year. I will add one of the things that we can do as a community, which is what a lot of the restaurants and shops have done, which is to really beef up their ventilation systems. We know that this is an airborne virus. So, when you're outside, the risk is very, very low unless you're playing rugby and, exerting yourself right next to a bunch of other people. And when you're inside, the amount of ventilation is sort of the key thing, and how far apart people are. And the town of Bar Harbor has done a great job again this year, encouraging restaurants to have spaces outdoors. So the risk is there, and the risk can best be controlled by you being vaccinated. And if you are either unvaccinated or you don't believe your vaccine is fully effective, you take an arthritis medication, you've had a transplant or something, asking people around you to mask or staying away from people who are unmasked. Wearing a mask yourself is helpful, but it's most important to stay away from unmasked people, especially people of unknown vaccination status. And actually, I did want to address something right now, because a thing in the chat, someone talked about people who had transplants or oncology treatments who are not able to get the vaccines. They are able to get them. The concern is they are not fully effective. Since you asked, there is some really interesting data out of one of the big transplant centers where they've been vaccinating all their people. And then they've been doing detailed analysis of the level of immunity. And they were, not surprisingly, not happy, because their transplant patients that they'd vaccinated and their oncology patients that they'd vaccinated were not showing as good an immunity as their healthy young people. And so there's now some research going on about giving those people a third dose of vaccine. So people who are immunosuppressed not only can be vaccinated, they are at the highest. They were actually one of the earliest groups that the CDC prioritized for vaccination. Unfortunately, while they can be vaccinated, it may not be as effective.
Thank you, JR. Chrissy, would you also like to respond to that question?
I think JR covered it expertly. The one thing that we just need to reinforce is transmission typically happens through travel, and we just want to make sure that we're a destination. If you have been in Bar Harbor, you have seen the uptick of this very vibrant community coming back to life with our visitors from away, and that we just have to, again, just when you're traveling, be very cautious and understand where you're going. We used to talk about this quite a bit before the vaccine, and I think it's really important to remember that you should be studying that map on the US CDC's website and understand where the high prevalence of those 11 states that JR just mentioned are, and that where you're traveling and how you travel to and from that can actually expose you or expose your children who don't have eligibility for vaccines. So again, it's really that heightened sense of awareness. And I know we all want to take that really deep cleansing breath and think that we are seeing the light at the end of the tunnel, because I think we are. We're going to be dealing with this virus for years and years to come, but we need to make sure that how we deal with it right now is there is some heightened sense of protection that we can all exercise in order to prevent the spread of COVID, and to JR's bringing it back, unintentionally bringing it back to a community and to into communities with children.
Thank you both for discussing that risk associated with travel as we approach the warmer summer months and the higher travel rates. JR, the next panelist question is for you. How are vaccinated pods different from herd immunity?
A vaccinated pod basically means everybody in the group is vaccinated. And what we know is that if you're vaccinated, the chance of getting infected is very, very low. And interestingly, even if you get infected, your amount of virus that you excrete, how much you breathe out on your neighbors, is even lower than a typical infected person. And if they are also vaccinated, then they're protected. So basically, it's 3 layers of protection. If everybody in a group is vaccinated, then the chance that, if I'm vaccinated, the chance that I will get infected is low. If I get infected, the chance that I will be breathing virus out is very, very low. And if Trevor is also vaccinated, which he is, he and I were sitting there holding our Band-Aids at the same time. I think I got my shot first, though he insists he got his first. He, even if I were to somehow be infectious, he's not going to get it because he's protected. So vaccinated pod is essentially the highest state of herd immunity. Herd immunity, as a general term, means something slightly different. And that's like a wet forest. You can start a little fire somewhere in a forest. You might get the understory under a cedar, the lower branches on fire. But if most of the trees are wet around it, it won't spread. Lack of herd immunity means there's enough dry trees that the fire can find from one dry tree to another dry tree to another dry tree. And it won't self-extinguish because the dry trees are not separated by wet trees. When you get enough people in a community who are immune, the virus can't find its way from one person to another. With COVID-19, we're finding that's extraordinarily difficult. And the reason that we're not getting anywhere close, even in areas which have a fair amount of immunity, is because vaccination is not random. There are some groups that are choosing to vaccinate and some groups that are choosing to not vaccinate. And those groups that choose to not vaccinate are spreading it among themselves and sustaining the outbreak. So you might have a state that has 70% or 80% of the people immune, which normally you would say would prevent transmission from person to person. But if there are subgroups where only 40 or 50% are vaccinated, they will continue to spread it among themselves, and then it will continue to spread back out into the wider community.
Thanks, JR, for explaining the difference between vaccinated pods and herd immunity. And hopefully this will help to keep us safe and help us to continue our safe decision making to keep one another safe. Trevor, our next panelist question is for you. Can you please speak to boosters for the vaccine and what that might look like moving forward?
There's a lot of questions around boosters and when it's going to happen and what it's going to look like. And right now, what we're hearing is sometime probably in 2022 or 2023 would be the booster. Potentially, most of the conversation I've heard is along with the flu vaccine in the fall of 2022 would be the most likely time for a booster. But we really don't know, and I think time will tell as they continue to look at this and we continue to see the development of COVID moving forward.
Thanks, Trevor. Our next question is actually one that came in from the Q&A as well. And it's a two-parter, so I'm going to give you guys the first part and then we'll continue with the second half of it. Is MDI Hospital still conducting sentinel COVID testing of local hospitality workers?
So we continue a public-private partnership with the state of Maine in their Swab and Send program. And our pilot program was to continue sentinel testing for front-facing workers. We have extended that in partnership with the state, who is extending that, and we continue to talk to businesses who would like to participate in a asymptomatic testing or sentinel testing program. What we are finding, and we've allocated resources appropriately towards our vaccination efforts, because there's no science to do sentinel testing or asymptomatic testing on fully vaccinated cohorts. It's actually not considered useful. So for us, we have one or two individual businesses that have remained in the pilot, but most have worked towards their effort of getting their teams vaccinated. And so it's not of use to do that sentinel testing. What we do continue to do sentinel testing on is those areas which might have the most exposure for an outbreak. So as an example, our employees at Birch Bay Retirement Village continue to do sentinel testing just to ensure that there is no potential asymptomatic employee who could potentially affect a senior.
Thank you. The second half to this question is, does MDI Hospital publish the number of COVID tests administered each week, as well as the positive results for Maine residents and out-of-state visitors? And if so, where can that information be found?
So we do publicize our positive cases, and we publicize it on our website. What we don't do is publicize whether they're in state or out of state. But what I can tell you is they have those results are aligned with the zip code of the patient's domicile. So what we are publicizing is only those which we tested and that would have been positive. What the state publicizes is those who live in Maine. So if you are comparing regions, and we try to be very blinded the data. We don't want to make this a stigmatized process. We want to make sure we're encouraging people to be tested. We want to make sure people are feeling that they are empowered and encouraged towards education and understanding the value of testing if you're symptomatic. So we publicize when we test a positive, and we do not delineate between whether that positive is out of state or in state. The state publicizes what's positive for domiciles in the state of Maine, because if it's an out-of-state resident, they are going to be allocated to their home. Whatever state that is where that positive will reside. And part of that is done for contact tracing purposes, and it's actually how the CDC, the national CDC, allocates infectious diseases. They attribute, and their attribution is based on the domicile of the patient.
Thank you, Chrissy. And also real quick, how many cases have been seen here on the island in the last few weeks?
None. Actually, we've had a very, very low case count. We've tested some, and we always are available for testing anyone that our practitioners feel are potentially concerning, but we have not had a positive in the last few weeks.
Wonderful. Trevor and JR, the next question is for you both. Can you share with us any immune response and specific side effects that are associated with the vaccine?
So there's a lot of people that I've heard horror stories about people who have gotten the vaccine who got very sick. But there are some basic immune responses that some people get. I can say that I didn't have any response, but my wife had a fever and an achy body. And my kids felt a little bit sluggish the next day after they got their vaccine. But for the most part, people who get the vaccine, about 20% of them, especially after the second dose, will probably have a little bit of fever, maybe some achiness. Just about 100% of people do have a sore arm. That's very, very common. And that can, you don't notice it until you lean up against the wall and you go, ouch, that hurts. But that's also very common, but really just maybe a slight temperature, feeling a little bit of malaise or tiredness, and so some aches and not feeling so good. We have heard about some people who have felt worse than that and really been down and out, but that's really resolves within 24 to 48 hours. And that's on the much more rare scale. Most people feel just a little bit run down for about 12 to 24 hours, if they feel anything at all.
And we are coming close to 5, so I would like to have you both weigh in on this question too that came into the live Q&A. This question is, a recent report showed that 20% of asymptomatic COVID patients later became long-haul COVID patients. These patients were studied before a vaccine was available. And what does this mean for fully vaccinated people who got infected with COVID? Is it possible that fully vaccinated people can be infected and become long haulers?
So, I mean, the phrase, is it possible? I suppose it is. It seems extraordinarily less likely. I mean, first of all, the vaccines cut your risk of infection by about a factor of 20, 95% protective for the RNA vaccines, a little bit less perhaps for the J&J, though it's pretty similar. So the chance that you'll get sick in the first place is much, 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 much less. And we have lots of data to show that if you do get sick, the chance that you'll become severely ill initially is even lower still. Whether or not that also means you will also be less likely to get long haul syndrome, probably, but I can't say nobody will get long haul syndrome if they've been vaccinated and then they get infected, but clearly it's much lower. Additionally, there's some very interesting data that there are some randomized trials that have started for this, but I think they're going to have trouble recruiting because the word is already out there that it seems to be true. So people are just getting it done. Is it people who have long haul COVID, who then subsequently get vaccinated, seem to have a decrease in their long haul symptoms? That's not been fully proven yet, but there's some decent evidence that that's true. So that would be another reason to think that that's probably not be true, but I can't say that nobody will, get it. But it's certainly much, much less likely.
Thank you. We do have one final panelist question, and this is for any of you to respond to. Is it safe for fully vaccinated people to dine inside at restaurants, including those restaurants that might be crowded and or without ideal ventilation?
JR, this is all yours.
So yeah, Chrissy, when I started getting optimistic this spring, Chrissy said, I'll believe that you really trust the vaccine when I see a picture of you at Jack Russell's. So shameless promotion. That's where I go for steak. So it's not entirely safe because it's a huge fatty steak. So I suppose I could choke on a piece of that delicious steak if I try and eat it too fast. So aside from the risk of eating too much really, really good steak and having a tummy ache, I am not worried. I worry about a fair amount of risks in life. I'm both a risk taker and a careful person mixed. But that's what it's about. If you do not have an impaired immune system, the protection from serious illness is close to perfect. You know, is it conceivable I could get infected with COVID? Yes. Is it the chance, however, that I will end up in the hospital? Close to zero. It's more risky driving to the restaurant with the crazy traffic in Bar Harbor than it is going into the restaurant, as far as that's concerned. So yeah, I mean, the quality of this vaccine and the effectiveness is unbelievable. So yes, I have no concerns whatsoever about that type of exposure if you are vaccinated, unless you have an immunosuppressive condition.
Thank you for responding to that final question. That was from the Q&A. And thank you, panelists, for your thoughtful responses and for joining today's discussion. I'll now turn it over to Chrissy to close.
Thank you, Molly. Thanks for doing a great job again facilitating this. And JR and Trevor, thank you as well. We are very thankful for all of you spending time with us and your thoughtful questions and joining us this afternoon. I also like to continue to encourage the dialogue, and if you have questions, please feel free to submit those questions to us, and we will look forward to answering those either through another community forum or through our FAQ. As we enter the latest phases of COVID-19 pandemic and our response, we are committed to providing you with evidence-based care and as much information, education, and support as possible so you can make a valued decision. Moving forward, remember our vaccine sites are available by appointment in our 3 health centers: Cooper Gilmore Health Center located on our Bar Harbor campus, Trenton Health Center located in our Trenton Medical Office building, and our Community Health Center located in Southwest Harbor. I do want to make one correction to a statement I said. I was immediately corrected that within the past month, we have in fact had some positives. They were localized to a travel with a family and a couple others. So we have had a few positives, but again, we believe that our mitigation strategies and adhering to safe travel practices will help with reducing the spread of COVID. So thank you again for your ongoing commitment to the health of our community and your participation in this discussion today. We look forward to hearing from you soon, and we look forward to a healthy, safe summer. So stay helpful, hopeful, and healthy, and we will talk to you soon.